So this first bit, the very brief bit actually, it's just a follow-up from the last briefing where we talked about the fair cost of care exercises and looked at what those meant nationally. That we looked at the headline figures basically, which is the overall cost of running care homes, or the overall cost of care homes per week and the overall cost of home care services. But within the fair cost of care exercises, that's actually broken down in a bit more detail. So for home care, it's broken down to care worker costs, business operation costs, and return on investment. We thought it'd be interesting to see what that actually looks like nationally and also at an individual local authority level, because it's all very well known what that figure is, but actually it's quite interesting to see how the overall cost of care is made up. We just looked at home care because it gets very complicated to start and look at the care homes because there are lots of headings and there are 150 local authorities with 300 different documents to plough through to try and work out the figures. So the quickest way is just to look at home care to see what the figures look like. So this is the national picture. So the shading is the overall cost of home care, which goes from effectively £21 per hour in the light shaded areas, the Yorkshire numbers of the Lincolnshire there, North East, up to the expensive end, which is the dark shading. And the percentages are the percentage that the care worker costs make up of that overall cost of home care. So 68% of the overall cost of home care is made up of care worker costs, compared to London and the North East, which is 75%. Although we look at the map and you think it's just a random mix of figures, and it does look like that, but actually, if you do look at the figures, there is a correlation between the cost of home care and the amount of deprivation. So effectively, the more deprived an area is, the less home care costs, which is probably broadly what you'd expect because workers generally cost more in more affluent areas because the costs drive cost of living higher. This is a quick breakdown. 3 columns: care worker costs, business operation costs, which are all the back office costs, basically running the business, and the return on investment, which is the percentage that local authorities thought was reasonable for providers to charge as a profit. And as you can see, they're not very generous. The average is 5%, or the median is 5%. Care worker costs, as I said, the overall average, 73% of the overall cost of home care is made up of care worker costs, and 23% is made up of business operations. And based on the average cost per hour of home care across the country, which is £23.25, then this is based on the fair cost of care. It's not based on the current costs. This is how much providers thought it actually cost to provide services, and so it's not how much they're currently being paid. It works out about £17 an hour of that. It would be care worker costs, £5.28 would be business operations costs, and the massive £1.10 would be the profit. But actually, as always, there's quite a lot of variation. So, for example, on care workers, in Gloucestershire, 82% of the overall cost of home care goes towards care workers, whereas in Ealing it's only 62%. Business operations cost, 33% in Wiltshire, and only 13% in Bracknell Forest for some reason. And then on return on investment, if you're in Torbay, you're in luck, you're getting 10%, whereas you only get 3% in Cheshire East. And actually 3% is a fairly common figure. Most of it was 3 to 5%. It was very few which were as generous as Torbay at 10%. And you can see there across the country, well, firstly, in terms of the split between urban and rural areas, care worker costs slightly higher percentages in urban areas, but the differences aren't really that significant. There's a bit more difference across the country, though, in terms of region. So you can see, as mentioned, London, North East have the highest cost in terms of care worker costs. In the southwest is the lowest, but the split of the other ones is very similar. Although again, southwest, the low percentage there is made up really of the business operations costs. But there don't seem to be any particular reasons why those would be in terms of geography. And this is what the breakdown looks like overall, again by region. So you can see London top end there, 75% equal with the North East, and the southwest down the bottom. But actually overall, there's not a vast amount of variation, certainly at a regional level. Looking up, sort of went through this figure to see if there are any sort of correlations between these and what might be driving these costs. So the first thing is that there's an inverse correlation between care worker costs and the overall hourly cost. So basically, the higher the cost of care, it's generally driven, those higher costs are generally driven by business costs and return on investment, not by care worker costs. So income generation is really driven by the business costs rather than your care worker costs, because they're really the fixed cost of providing care. Business operation costs and profits are both correlated with the overall hourly cost. So that's basically the same as I said. But there's no correlation between care worker costs, business operations costs, or return on investment and the average size of home care providers. So I thought that you might find that bigger care providers have bigger operations costs, but that's not the case. There's no correlation. It seems to be just a random set of figures. The figures looked at are averages across regions. So as always with these type of figures, there's a lot of variation across local authorities, which I picked up some of those on the previous slide. So that's it for the fair cost of care. So I'll go on to the next bit, which is something we've sort of touched on a few times in the last few briefings, and we've done some work. We did a project for Greater Manchester, looking at what was driving leavers from the health and social care sector, because they're very concerned that they were losing more workers in the northwest, and particularly Greater Manchester and other areas. And actually that wasn't the case, but it did mean we did some digging down into why workers are leaving, and also a bit more about where workers are coming from, what's driving turnover. So we thought we'd pick up some of those threads now. So we're looking at data from Skills for Care. So they published their adult social care workforce data set, which some of you might be a member of. So it's a voluntary scheme, but providers can submit data to Skills for Care and basically just submit it as workers come and go from the organisation. And Skills for Care, I think it's about 40% of providers provide data to Skills for Care. It doesn't provide a vast amount of detail, but it does provide some. The best sort of data is actually the NHS, who have a much more comprehensive data collection process, electronic staff record, ESR, which collects a vast amount of data. And obviously that's one of the biggest workforces in the country. There's an awful lot of data there. So the last few years seen big changes in the workforce. So we're going to look at some of those now and what that means to you as an employer. After writing the majority of this, of course, the government published their NHS workforce plan, which you thought was going to derail all our plans. But of course, being a government plan, well, it's a 15-year plan, which is actually sensible because the kind of changes they're talking about, building up the number of doctors we've got, training nurses, is going to take that kind of timescale. We don't expect anything to happen on this in the near future, and certainly not within this Parliament. And of course, the big failing of the plan is it doesn't really talk about money, and particularly it doesn't address pay or job satisfaction issues, which are the things that are driving the current strikes within NHS, but also driving a big spike in staff leaving. So if you try and phone the NHS pension line at the moment, you'll have great difficulty getting through because they're swamped with people phoning up to find out what their position is in terms of their pensions if they're thinking about leaving. So I think they're finding an awful lot of staff are now thinking about leaving. So, and this is one of the things that came out of the Manchester one. This is data from the electronic staff record about the reasons that staff left over a period from 2019 to 22. And these are numbers of staff leaving in Greater Manchester. And it just gives you a sense of scale. So these are the numbers of staff leaving. So 4,000 staff left saying that they were unhappy about their pay and reward, relocation, end of fixed-term contracts and retirement, work-life balance, workforce transition were all the main reasons of driving people out. And all those about 3,500 staff leaving for each of those reasons. So, quickly up to 30,000 staff leaving over a 2-year period. Over workforce trends, so this is looking at what's happening across the whole of the workforce, broken down to the main workforces that operate with. So top line here, this is wholesale and retail trade, so it includes retail, but also sort of industry. We've got here is accommodation and food services, and then we've got the two social care bits. This is the general health and social welfare activities, so that covers NHS and all social care. And then you've got the Skills for Care data, which just covers CQC registered services. So you can see actually there's some common trends, and something we pick up again later is that the general workforce and in accommodation and welfare, or accommodation and food services, and the general social care workforce do mirror each other, but actually CQC registered services workforce has been fairly static and has dropped slightly. Retail, again, has seen a similar drop as well. So looking at data just on retail, because I think that often comes off as a big competitor to social care, you can see actually it is a fairly similar pattern, apart from this obvious reason in with COVID. But actually the pattern is similar, and both are showing this similar drop over the last year or so, as there's been issues about funding of social care, cost of living crises, staff leaving to look at for better paid employment. One of the notable differences in the workforce is age. So this is the age profile of the skills of care workforce. So this is the CQC registered workforce. So that's home care and registered care services. So you can see gradual progression. Biggest part of the workforce is 50 to 64-year-old. If you look at the overall UK workforce, it actually fairly closely follows it up until this point, where the adult social care workforce is significantly older than the general workforce. The most striking differences, though, is the retail sector, which is considerably younger. So you can see there the differences between the dark blue there, which is the skills of care data workforce, and the retail workforce, which is your competitors. And really, they're capturing all that young workforce, where by the time they've got to 50, 64, they're leaving to go and do other things. Perhaps explain some of the recruitment difficulties social care has in attracting people. One of the things we commented looking at these slides is some of it reflects a cultural issue which makes recruitment into social care quite difficult, because people like working with their peers. So if your peers are working retail, it's going to be quite difficult to go and work in a care home or care organisation where your peers may well be considerably older than you, which does tend to put off younger people when you're trying to get them into social care. So this looks at the overall social care workforce. So again, this is skills of care data, looking at CQC registered services. So you can see overall all job roles increased by 7% over the period. A jump there in 2021, which seems to be COVID related. And I think there may be two factors there. Firstly is there was more money around, so providers could employ more staff, but also it's harder for staff to move around because job vacancies there weren't as many job vacancies, so staff weren't leaving as much. So I think you've got two factors of more money to employ people, but also people weren't leaving. But then if you look at the detail, all managerial posts, slight reduction, 3% reduction, but a big reduction in regulated professions. A big part of that is nurses, but it also covers sufficient language therapy, anyone who has to have a professional registration in order to work. Direct care, that's obviously the majority of the workforce, so that very mirrors the overall job roles, and then other, which is a 9% increase. But if you drill down into the individual posts, a bit more interesting. So registered manager, increase of 9%. Registered nurses, which is where the big change has taken place, that's a 37% decrease in registered nurses. So you can see why nursing homes are having such a difficult time at the moment, because nurses are leaving. Some of that, I suspect, it might be difficulty in recruiting. There's a shortage of nurses generally, but also it's that pull factor to the NHS because terms and conditions are better there. And then care workers, looking particularly at care workers, quite a large increase, 15% increase. One new thing that comes out of skills care data is information on direct payments. So, and particularly individual employers. So that's people who've got direct payments who are employing their own care staff. The overall number of direct payment recipients has levelled off more or less. It's slightly dropped. And the number of direct payment recipients has stayed pretty steady, but declined very quickly from the initial start, which you can see on this slide. So the top line in dark blue is the number of direct payment recipients. So you can see there that despite all the pushing of local authorities and central government for direct payments, actually the figures more or less stabilised in 2014 and has stayed very similar since and dropped a bit over the last couple of years. And in terms of the percentage of people who direct payments employing people, really it reached its peak in 2011 with 37%. Before then it was 46%, but really it's been hovering around 36% or 30% since then. So only about a third of people who direct payments actually employ their own staff. I suspect the main reason is a change in the type of direct payments that are made. I think a lot more direct payments are now part direct payments. So it's an additional sum of money that people are given in order to commission particular types of additional support. So for example, if someone living in a care service who gets paid a direct payment to employ someone or to get some additional support to pursue a particular activity. But it might also be linked to the difficulty in employing staff directly, which isn't easy for people. And I think the early days of direct payments are when you saw those big payments of people getting 70, 80,000 pounds a year to staff team. And I think those days have gone, more or less. Local authorities don't do that anymore. The other incident that came out of this is care organisations. So this is the number of care organisations by the size of the workforce. This first column here is care organisations. So these are organisations which are PAYE or VAT registered adult social care organisations. The ones at the end are organisations which employ 1 to 4 staff, very small organisations, and an awful lot of them. And then on from there, it's still quite large numbers, but that first number, well, it surprised me. I'd have thought, well, what's going on here? And had a quick look at the CQC data. Skills Care said over 6,000 organisations providing social care services which have just 1 to 4 employees. I had a quick look on CQC registered services, and I worked out there are about 150 providers who operate a small home, a single small home, which would be more or less the number you'd get for that number of staff. So this data comes from the Departmental Business Register, and it excludes employees employing their own staff, so that's those direct payments people, and it excludes non-CQC services that aren't registered for VAT or PAYE. What it is, though, is that it's got quite a large definition of what counts as a social care organisation, and it brings in quite a lot of very small organisations. So I had a quick look on Companies House to see who these organisations are. In the year between July 22 and July this year, almost 5,000 new companies have registered under the registered care activities, learning disabilities, mental health and substance abuse category, and 1,500 were dissolved. And I had a look at some of these organisations, and are just very small care organisations. It might be a very local home care organisation with 2 staff who are serving a very small area, particularly supported housing, including housing benefit for one house with a couple of people. And there's an awful lot of a very big turnover of these as well. So there's a whole sort of almost hidden sector of the social care market that we're just not really aware of because they're very small organisations. Last bit's on Skills Care data. These are who the employers are for Skills Care data. So see local authorities, quite small directories of the change. So in terms of the direct care staff, not much change there. Most of them work for independent sector providers, and 6% work for NHS employers who are providing social care services. And there's been a 6% increase in that, and the direct care workforce in independent sectors decreased by 1%. Managerial staff, more of those work in the local authority sector, and there's been a quite large increase, 5% increase in those, 6% increase in managers working in the independent sector, but a 10% increase in the NHS. So again, that pull away from independent sector providers in toward the NHS. And finally, the regulated professions, again, big reduction in the independent sector. So the other question is where staff are going to, and I came across this data which was mapping of where people are leaving large cities, where they're going to. So the red dots are the place that people start off with, and the shading is the percentage of people who are moving out and where they're moving to. The percentages in the top are the percentage of the people who are migrating to somewhere other than a large city. So, for example, in Inner London, 86% of people are moving away into sort of more rural areas. And you can see there's quite a spread of people in terms of where they're moving to. For some reason, presumably that's Hampshire, people seem to be particularly attracted to. But actually, one of the notable things on all of these is that people in general don't move a very great distance. So for Bradford, for example, 55% move to somewhere other than a large city, because I think most people are moving towards Leeds. So they're migrating away from Bradford to Leeds. Sheffield, it looks like they're going to Doncaster. So one notable thing is that the smaller areas in general, they tend to have more people going to other large areas. But I think that might be just proximity. But I think the other notable thing is that people don't move very far. That actually most people stay within their immediate area. So they move within the local authority neighbouring where they're currently based. And I suspect that the people who are moving further away are probably much more affluent. Looking at also migration is immigration, which is the other place that there's been big changes in the workforce. So this looks at the number of visas granted for different workforces. Now, there is a change taking place in 2011 and 2022, which introduced the skilled work, health and care, and the skilled work categories. But those categories have shown a big increase as well. Drilling down, this is the skilled workers health and care. So this is the number of visas granted by quarter. So you can see massive increase. It's gone from, well, nothing in quarter one of 2021 to 25,000 in the first quarter of this year. Yeah, so skilled worker grants have visa grants gone up by 59%, and the skilled worker health and care visa grants to the main applicants have risen over 2.5 times. And that's partly because in late 2021, the category of care workers and home carers was introduced as alongside senior care workers. So you can see this is broken down by the main categories within the skilled worker health and care. So you can see nurses was quite large, but actually the largest category overall is nurses coming in. But then you've got care workers and home carers, which have gone from nothing up to 19 and now 20,000 in the first quarter of this year. So this is year to date. This is the whole of last year. Senior care workers, again, this is just the first quarter, and this is where they're coming from. So you can see, actually, most people come from a very limited number of countries. Looking at these, so again, this is just for the health and care staff category. By quite a long way, the biggest proportion of people come from India, followed by Nigeria, Zimbabwe and the Philippines. Then a drop off, and then we get off to other countries. Next one is Canada there in position 24, and they only have 504. The first European country that has people coming in now is Greece in position 27 with only 372. So there are more people coming from the United States to work in health and care now than there are from Greece and Albania down there in sort of the fuss about number of people coming from Albania. That's position number 24, and only 250 staff coming from Albania. So what was quite a large workforce coming from Europe originally has disappeared more or less. Conditions of moving in is that coming into the country that you have to be offering your workers at least a going rate for the post. So each type of position has a going rate for it. So these are the current going rates. So health service and public health service managers and directors, 41,000. Care workers, they have to be paid at least £21,000 a year, or £10.75 an hour, which is a good care worker salary. Senior care workers, for some reason, is lower. I don't know why. And then you get some strange posts. So fitness instructors, for example, I don't know why they're paid less than dancers and choreographers. And market research interviewers only get £5.44 an hour as their minimum rate for some reason. The number of full posts in both retail and social care is falling, but they do have very different workforces. And although some of this gap is filled through migration, and particularly immigration, that at most covers 50% of the posts. And there are also various difficulties with the immigration schemes, because the salaries, if you're thinking of trying to rent somewhere in the south of the country, those going rates won't go very far. So if you're on £10 an hour, you're not going to get very far with that. There's quite a strong pull from social care to the NHS. The data we looked at, 18% of social care workers leave to work for the NHS, compared to 4% of staff going from NHS into social care. It's not possible to track the number of EU citizens who have left because they weren't recorded. It was free movement, so we didn't know what numbers are here. But the current levels of immigration is very low compared to how it used to be. And on direct payments, overall numbers are declining because of the way that the types of direct payments. And then in terms of staffing, when staff do move, in general, they move to within a fairly small area within there, certainly within the region, and often to a neighbouring authority. But it does mean that you need to develop regional workforce plans when you're thinking about workforce development to see how you can continue to attract those staff. One of the big challenges facing social care is how to address this very different workforce profile, age profile to other employers, particularly given that quite a lot of these workers are coming up to retirement age, and you are looking at potential crisis of people leaving from one end of social care but not being replaced coming in at the other end.